What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for March 31, 2021. A COVID-19 update from a North Dakota hospital. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Doug Griffin, Vice President and Medical Officer of Sanford Health in Fargo, North Dakota, a state that last fall had the highest COVID-19 rate per capita in the world. They discuss how the hospital survived that surge and how things feel today. Let's listen. Dr. Doug Griffin, thanks so much for joining me.
Hey, you're welcome. Thank you for the time.
So I wanted to talk to you about the COVID pandemic and how it has sort of ebbed and flowed in your hospital since in the past year. First, I'd like to start with, North Dakota, as we know, was hit very hard during the peak of COVID. In November, I understand that North Dakota had the highest COVID rate per capita in the world. So what did that mean for your hospital? What did things look like? How did your staff feel? Describe that for me, please.
Yeah, it was, I would say, in reflecting back, we were very close to being overwhelmed, but we were managing it. We basically pulled out all the stops, brought in a ton of extra staff at a big cost, repurposed a lot of other staff to help and assist. We were getting requests for admissions from as far away as Montana, down in the Twin Cities of Minneapolis and St. Paul, requesting to send patients here. Of course, South Dakota and Northwest Minnesota, the regions that we serve. So it was very hectic, very chaotic, and we were running at 150% 24/7 there. So.
What was the impact on your staff?
It was stressful to the staff. I think a lot of times when you're within a very stressful situation, the body and people have the resilience to kind of keep going. I think it's once you get beyond kind of the crest and you're able to take a breather that I think, people really started reflecting more on how difficult it was for them. But we realized that we were asking staff to work a lot. Many worked extra. Did not hear complaints about doing extra work and doing that. I think people had great pride for that, but it was stressful, and I think people paid a toll. I would say that's fair.
It's something you sort of never expected you'd have to deal with.
Pretty naive. In the spring, we got a bit of a surge that then went down quickly, and we had a pretty quiet summer. And then you're kind of thinking, well, maybe that was it. But then, the Southwest and South really got hit, and we started seeing it a little bit in the West. It's like we could almost see the tsunami coming. And I think that allowed us, we had done a lot of preparation for a big surge in the spring. We just didn't get it as big then, but then it came in the fall, and we had plans in place. We were ready to go.
So today it's different there. Talk to me about what it's like right now in North Dakota, in your hospital.
Yeah, we're much prouder to say that we have the highest success rate in giving out vaccinations than having the highest COVID positivity rates. So doing that, we still have a few COVID patients in the hospital. Things have kind of plateaued there, about a tenth or less of what we had at the peak. We're basically in normal operations, for the hospital at this point in time, but still in that dichotomy of encouraging people to get vaccinated and continue, masking and social distancing and things as well. As every day passes, I get a little bit more comfortable that we won't have a huge another surge, maybe not as big. Could a smaller surge happen? I think that's a possibility. We're kind of feeling like we're a bit of in a race with getting shots in arms and before, for example, a specific variant really takes hold.
So how was North Dakota able to turn the tide?
I think we did at some point in time after, I think seeing really how impactful it was in the state, masking became mandated more widely embraced. So I think that certainly helped quite a bit. So I think many people got scared. They knew somebody that had been severely ill and perhaps had died. And I think that made a number of people, not everybody, but a number of people kind of, hey, can be really serious. And I think the fact that they saw hospitals, and we were constantly in the news, national news, beds being, very short and tight and critical. So I think that really got people's attention.
You mentioned mask mandates, and I was going to ask about that. I understand that in North Dakota, the mask mandates have ended, and that there's even been an effort in the legislature to ban mask mandates.
I sure hope that gets defeated.
Yeah.
We're kind of right in the middle of the session here too. Citywide mask mandates do continue. For example, still in Fargo, we have a mask mandate as well. And I would have to say in the Fargo-Moorhead metropolitan area that we're seeing that, out in public stores, and that's for the most part, we're seeing very good mask uptake. It's a little bit, the western part of the state, I hear, is not quite as good about that. And I personally really haven't ventured into restaurants or bars to see. I think the servers are doing a very good time, but I'm still a little nervous about gathering in those sorts of spaces. So, and I think a lot of people are.
Yeah. Are those places open?
They are. And I don't think they're as busy. You could ask a restaurant over. I'm sure it's been very tough on there. I don't think it's as busy as usual, and they're taking precautions. But, we get concerned. People are, in a smaller space. Ventilation is not as good. You have a mask off while you're eating. You can do that. But I think for the most part, I think people are eager when things can fully get back to normal. Common question. We don't know, but I think our stance, mine personally and ours as a system, is we need to keep on with all the guidance from the CDC, get the vaccines, and it's not until we get a much better level on this that we can relax.
Even though North Dakota is doing very well with vaccines, nobody's doing that well with vaccines.
Yeah, we're eager. Our supply is going to be right, so far I think we're a little over 20%, need to get much, much higher. Our supply is getting stronger each week, not just the health systems, but other systems. So I think that's the real key, giving our first Johnson & Johnson vaccines today, I believe. So, we're eager to get more. So.
And is that sort of a shift for you? Is that something you're doing at the hospital, is giving out vaccine?
Yeah, so we've actually made our vaccines, because it's, we give 1,000, or up to 1,000. And we're just one partner doing that. So we created a citywide vaccination center off the hospital campus. So that way we can have a big parking lot. People, it's an old store, can get in and out. Otherwise, that many people getting vaccinated, just kind of disruptive to a hospital workflow or a clinic workflow. So we're kind of keeping that separate.
So things are much quieter on the COVID front inside the hospital than they were. Is it okay to breathe a sigh of relief, or are you still sort of on tenterhooks here?
Yeah, I think a little bit, like I said, I think still a little bit feel like we're a little bit on hot coals and tippy toes here. But as every day and week, goes by, I think we're getting a little bit more comfortable with that. But, we've not gotten, we were down to as low as 4 inpatients. And I thought, oh boy, we might get our last. And then yesterday we had 13. So, again, far below what we had maxed out at. But, we'd like to see 0 at some point in time.
Yeah. Do you see that in the future?
Well, we're the largest. I think COVID admissions will probably continue and straggle in off and on for a long time. So will we have some times where we have no COVID patients in? Absolutely. I think that'll happen. but I don't think it'll go away, for good, where, yep, this is our last one and we're not going to see another.
So reflecting back, you must be proud of how your staff handled this, and also just sort of surprised that it ever happened the way that it did.
Yeah, well, extremely proud of our staff. And, we have a lot of conversation personally thanking them. What can we do to continually wanted to make sure that we are appreciative of their work throughout this year. We will begin tomorrow, will be 1 year to the day when we opened our incident command for this, which basically continued for many months and kind of actually continues on a virtual basis to this day. And so we're gonna recognize that. So we have a variety of things to do, not a celebration, but a recognition of great work done here too. But I don't think any of us, if you had, a year ago, even though we saw that it was potentially coming, knew that it was coming, could have said exactly how it would have looked and what it was going to look like. So we were surprised, continued to surprise the hurdles, the obstacles, things that we had to achieve, getting enough supplies, testing, logistics, staff, all sorts of things.
What do you think is the biggest surprise that you encountered?
I have a bit of regret for our country. I was surprised how politicized doing the right thing for public health became across the country and within our state as well too. I always had thought that public health measures, which managing through a pandemic, I think certainly qualifies, were apolitical. And unfortunately, that was not the case. And I think it has hurt our response. Not our personal response, but I think things could have been a bit different. Still would have had a pandemic, but I think things could have looked different.
Dr. Doug Griffin, thanks so much for joining me.
You're very welcome. Thank you for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.